Good morning, everyone, and thank you for being here this morning. My name is Angela Johnson. I'm the program manager for the Stronger Together grant at Albany State University, and I will be leading this introduction this morning. This meeting is being recorded for those that could not attend this morning. If you would please in the chat put your name, your organization, and the county where you are, please. Stronger Together was funded by the Office of Population Affairs for their Tier 2 Teen Pregnancy Prevention Innovation funding. The funding is intended to support the exploration, development, and testing of innovations related to teen pregnancy, and there were 7 key priority areas that grantees could choose from. Albany State is one of 13 grantees that were chosen across the country, and the key priority area that we chose was expectant and parenting teens. This includes males and females ages 15 to 19, and also includes their support systems, such as their parents, caregivers, siblings, peers, and youth-serving professionals. So the goal of Stronger Together is to build a multidisciplinary, innovative network of community partners in 18 counties in Southwest Georgia through the creation of 6 Innovation Hub Action Councils that will include expectant and parenting teens and adults, and they will develop locally owned and governed, innovative, expanded, or enhanced projects to meet the needs of expectant and parenting teens and those who support them, reduce repeat pregnancies, reduce STIs, and improve optimal health for teens. So our objectives are to build new partnerships and communication, increase knowledge in the community about expectant and parenting teens and their needs, facilitate the creation of action councils in the 6 hubs over the 3-year grant period, develop an electronic database for peer support sharing, bring training to each of our counties, such as neuroscience, trauma and stress impact, community building, innovation process, model programs, and collective impact processes, and support the creation, implementation, and evaluation of innovative projects that focus on the needs of expectant and parenting teens. Here you can see the counties that were selected for this grant project and how we divided them up to cover over the 3 years. So we started with Hub 1 and 2 in our first year, which is coming to a close now. That include Doherty, Lee, Sumter, Terrell, Randolph, Clay, Quitman, and Calhoun. And now we're moving into the Hubs 3 and 4 counties for our second year of funding, which includes Early, Miller, Mitchell, Baker, Seminole, Decatur, Grady, and Thomas. Here you can see the number and rate of teen pregnancies in each of the 18 counties over the 4-year period of 2016 to 2019. This grant includes both those who are pregnant and parenting, which is why I went with the 4-year period to give us an idea of the number who are both pregnant and parenting at any given time. And I did bold the counties in Hubs 3 and 4. And you can see that all but 2 of the 18 counties have a higher teen pregnancy rate than the state of Georgia. So there's definitely a need in Southwest Georgia for services. Some other community factors. All of Southwest Georgia counties, except for Lee, have a child poverty rate of over 20%. meaning that 1 in 5 children live under the poverty level. In 15 of the 18 counties, it's more than 30% of children living in poverty. And in 3 counties, Clay, Early, and Mitchell, it's over 40%. In Georgia, 34% of children live in a single-parent household. In all but 1 of Southwest Georgia counties, it's greater than 40%. 8 of the 18 counties have greater than 15%, and Randolph County has the highest with 77% of children living with a single parent. In Southwest Georgia, a little over 1,400 teens aged 15 to 19 were diagnosed with an STD in 2019 alone. And 16 of the 18 counties have a higher chlamydia rate than the state, and 6 counties have more than a double rate than the state rate. And the number of teens ages 16 to 19 that are not in school and not working ranges from 2% in Terrell County to 30% in Decatur County. In 7 of the 18 counties, more than 10% of 16 to 19-year-olds are not in school and not working. I'm sorry, I didn't realize you couldn't see those slides. Here you go. Here's the teen pregnancy rates. And I will send out the slide deck to everyone as well. We're including what we're calling radical partners in some of our programming. These are model programs or trainers in their fields that are bringing knowledge and expertise to our area. We have the Phoebe Network of Trust program, which is a model program. It's a school-based service for pregnant and parenting teens that provides education and support to girls in school. SABS and Associates, who does community empowerment organizing and leadership training. MeWe Georgia provides communication tools that enable individuals to unlock their agency, reframe their narratives, and author the future. They primarily do training with youth. And Global Trauma Project, which supports local change makers in increasing resilience and reducing the impacts of compound stress and complex trauma by training, mentoring, and certifying trusted community members to facilitate trauma-informed programming. And they will work primarily with adults in the area. So how can you get involved? We have social media accounts, Facebook, Instagram, and Twitter. So please like, follow, and share those, and I will post the links to those in the chat. We also have a community survey that we are doing to assess the community on how they feel about teen pregnancy and its effect on the area and on youth, sexually transmitted infections, etc. So if you would please fill that out. There are 2 different surveys. One is for teens, age 15 to 19 to fill out, and the other is for adults who are age 20 and over. And I will post both of those links in the chat as well. You can join the Action Council for your county and hub, and the Action Councils will really be the driving force in this project. They will meet regularly along with teens, expectant and parenting teens in the community to really get a sense of the needs of teens, what services and supports are available, where services and supports would best fit within their community. And then we'll look into exploring and developing actual innovations with support from the Stronger Together project. Our radical partners will be offering training throughout the year, and we will make those available to everyone. And reach out to expectant and parenting teens in your community to let them know about the project, encourage them to join the Action Council, and be a part of creating these services that will support them. And here is our contact information and the links to our social media again. At this time, I'd like to open it up and get questions, start a dialogue, encourage you to share about your community and any resources that are available, people who need to be at the table,